Hello, everyone. Thank you very much for joining us today. My name is Isaac Wink. I'm the Research Data Librarian with UK Libraries. And welcome to Who's Counting? Locating and Using Gray Data in Health Sciences Research. This is the second and final installment in our Gray November series, part of the research workshop series of the Medical Center Library here at UK Libraries. If you didn't see previously, 2 weeks ago, Health Sciences Librarian Kayla Robinson's excellent presentation on gray literature and systematic reviews, I very much encourage you to check that out. And if you are a fan of Taylor Swift, then I hope you appreciate the Taylor Swift theming we have going on for this series and the Reputation era theming for this workshop in particular. If you are not a fan of Taylor Swift, then don't worry about it. I still promise you informative and hopefully engaging content. So before we dive into it, I wanted to start by just introducing the services that I offer to researchers across University of Kentucky. So in my role as a research data librarian, I work with researchers on addressing all sorts of different data management and sharing issues that they may run into. Some specific services that I offer there is assistance with writing your data management and sharing plan for grants, most commonly for the NIH and NSF, but for other funders as well that require one of these plans. I can also help you navigate and get started with data storage and data analysis resources from across the University of Kentucky. So if, for example, figuring out how to store big data is a problem for you, then come talk to me and I can help you navigate some of the options available to you at UK. And then finally, and most pertinent for today, I provide assistance in finding, accessing, and evaluating data for secondary data analysis and other forms of research as well. So this session is going to focus on some of those resources and how to identify them for your research. But if there's anything outside of that scope, please do feel free to contact me and I'd be happy to help you with that. So I wanted to start out by level setting a little bit by providing a definition of gray data, since it is kind of a little bit of a wonky term. I know in academia, we're always establishing new terms for things, and this is no exception. But this is one that I think can really kind of help frame the way we think about some of this data. To start with that, though, I wanted to contrast the way we can think about gray data with the way that we think about research data. So research data, broadly speaking, refers to data sets produced and disseminated within the standards set by a discipline to maintain research integrity. So these are often data sets that will get shared as a supplementary piece to a research publication that's published usually in a peer review journal. Although in some cases there may be data sets that are published as standalone resources as well. And that term, a standard set by a discipline to maintain research integrity is one that can be intentionally a little bit vague. When it comes to published literature like articles, we often see peer review as kind of being the gold standard for ensuring the integrity of that research, for providing a safeguard to make sure that the results in that publication can be trusted and can be built upon by others in their research. For research data sets, however, that standard of peer review is not always present in the same way. When a data set is included as a supplement to an article, it's often shared with the peer reviewers who may have a chance to review either the raw data itself or the code or analysis that a researcher conducted. But there's not always necessarily a guarantee that peer reviewers are looking at those data sets as closely as they are at the actual text of the article itself. So a data set in that context might be part of the peer review process and may or may not kind of be looked at closely there. But there are other standards that research and academic communities apply to other data sources to make sure that they're of sufficient quality for others to be able to build on and work with. And so one example I wanted to give of that is the NCBI GenBank maintained, I believe, by the National Library of Medicine for gene sequencing data. This is a repository where any researcher is able to submit sequencing data to that repository. There are certain deposition standards and formatting that needs to happen for data before it's submitted there. Um, and then that data then goes through this quality assurance process and this process of checking for errors. Sometimes there may be a dialogue or back and forth with the depositor so that they can address some of those issues. But that quality assurance process takes place before any sequences are published as part of the public archive so that others are able to use them in their research. And I bring this up because it's an example of the ways in which around research data, there are still standards of integrity and standards for what makes data of sufficient quality to be usable in research. It's not necessarily always peer review in the way that we may be used to thinking of it for publications, but those standards are still there. And for repositories like NCBI GenBank, they are designing those standards with keeping in mind the idea that they want other researchers to be able to use these sequences in published data or in published articles that they produce in the future. So it needs to be kind of that quality for academic research to take place. So that brings us now to gray data and some of the ways that it contrasts from research data. So we can think of gray data as a subset of gray literature. And again, I encourage you to check out Kayla's presentation from a couple of weeks ago if you'd like an overview of some of the other types of gray literature that we might see. But gray data in particular refers to data that's produced and made available by organizations, typically outside of the traditional research publishing process, meaning without peer review or without the standards of quality control that would be common to academic research. What I really want to stress here is that this does not mean that gray data sets produced by governments, by nonprofits, by advocacy organizations, it doesn't mean that that data is of low quality or can't be trusted or can't be used for research purposes. But it does mean that you as a researcher need to go through a careful process of evaluation and making sure you understand how that data is collected and for what purpose to understand if it will fit your research need or if there are changes that need to be made to it before that happens. And I wanted to include this quote as well, which I think really kind of encapsulates a lot of the value to researchers in sometimes going outside of those standards of academic research data sets to explore some of these other ones as well. Quote, gray data sources lie outside mainstream visibility, are often overlooked in policymaking, and are vulnerable to misinterpretation. When thoughtfully integrated, these underutilized sources can help close critical knowledge gaps, anticipate emerging risks, and support more inclusive and context-sensitive public health action. So that's really kind of the case for considering some of these data sources and having having a familiarity with them. Particularly if you are looking to write or do research on an emerging problem or challenge that's really changing a lot very quickly, looking at some of these data sources that are published and updated more frequently can really be a source there. It can really be a resource there for being able to write on some of these more emerging topics and incorporate them into the traditional research process as well. So there are three general wide categories of producers of gray data that we're going to cover today. And then there will also be time for us to go through some of these sources for identifying some of these gray data sets and that may be kind of generally applicable and useful. But in going through this section, my intention is to also to provide you with some context on how you may be able to find the right sources that are most relevant to your particular discipline or the type of research that you're looking to conduct. Since these data sets, exist often outside of mainstream academic publishing, they often, in fact, are not cataloged or indexed in the same way, meaning that they can be more difficult or trickier to find than academic data sets. So the first producer of gray data we're going to talk about are government agencies. Governments, both state, local, federal governments, and international organizations as well, produce a great deal of produce a great deal of data that serve a variety of stakeholders, not just academic researchers, but also policymakers, private businesses, journalists, and citizens who are interested in transparency or accountability, or just identifying problems in their local community. And I bring those up because with a lot of great data sources, it's always very important to understand the context of why this data set is being produced, and who it's intended to serve, because that can shape things like how that data is collected, what standards there are around the quality of that data set, and whether or not it's appropriate for academic use. So some common examples of data sets that are produced by the federal government that can play a role in research are things like the US Census or the American Community Survey, and the data that gets produced out of there, information on Medicaid and Medicare spending data, claims information, that kind of thing, and product data that gets reported to the government by drug manufacturers. Some of these may be familiar to you within academic research already. The US Census, for example, is a very common data source for doing population or demographic research, in large part because it is held to such a high standard of how that data gets collected. So sometimes, the boundary between what we might consider academic or research data and gray data can be a little bit fuzzy. And that's okay. I kind of see gray data mainly as being useful as a lens for considering some of this extra evaluation that we may need to do with some of these data sources. So a couple good kind of clearinghouses or catalogs for finding government data sets that would be particularly relevant in health sciences or public health include data.gov, which serves as a clearinghouse for data sets from across the US government, as well as healthdata.gov, which in particular is home for data produced by the Department of Health and Human Services and some other agencies that they interact with. So those deal specifically with data produced by the federal government. But there are also a lot of agencies at the state or local level that produce and make data available as well. So the Kentucky Cabinet for Health and Family Services, for example, provides a series of data dashboards on a variety of public health topics in university or in Kentucky. And you'll find that there's kind of a lot more variety around those data sources or around kind of how those dashboards look from one state to another. Sometimes you can just find representations of that data, but in other cases you can find get access to the underlying data as well. There's a question in the chat on could you speak more to how the trustworthiness of government data has changed in our current context? For example, changes to Bureau of Labor Statistics leadership and undue influences or the executive branch, and what do we as researchers do about it? So in response to that question, I would start by saying that the vast majority of federal data does remain a very good source around a very good source for being able to use for academic research, particularly when we're viewing it through this lens of gray data, where we're already going to be applying a bit of a critical eye to it to make sure that it's actually fit to the purpose that's being used. To the question of sort of, have there been changes to federal or government data sets? This is something that I've kind of been tracking in my role, and to my knowledge, there have not yet been proven changes to kind of established or long-running data sets that are produced by the government. But this does remain a topic that a number of researchers are interested in kind of evaluating and looking at to see if those changes are taking place. So if you do believe that a data set may have been changed in some way that you previously worked with, or that you want to work with but kind of want to see if it's been changed, there, in addition to kind of looking at some of that literature and seeing what other researchers have found, you can also look at archived versions of those data sets, or look at things like the Wayback Machine to sort of see how the pages for those federal websites have changed over time. There's a project going on currently as well called the Data Rescue Project, which is looking to create archives of a lot of different data sets, primarily from the federal government. kind of just to serve as a form of insurance to make sure that those data sets always do remain available in their original form, even if there are changes to how federal sources present those data sets, or if they remove them entirely. So I know that's kind of a long answer to the question, but in summary, federal data sources do remain of a high degree of quality. There is cause for concern around sort of, have there been changes there? But there are ways of being able to check if those changes took place, and organizations like the Data Rescue Project that can be worked with to be able to find those original data sets in cases where that may have taken place. So moving on from government data sources, another major source for gray data are NGOs, or non-governmental organizations, and nonprofit organizations as well. NGOs can be particularly useful for data in the international context, but nonprofits and other organizations operate locally or federally or nationally as well within the United States. So the data that they make available is typically produced for the purpose of informing policymakers or other stakeholders on how giving them data that they need in order to make those critical decisions for the public good. But it can also be designed to inform advocacy by that organization and produce and lead to research as well. So those are the types of stakeholders to keep in mind for NGO and nonprofit data. The quality, the format of this data can really vary from one organization to another. It can sometimes be rare to sort of find public databases that are maintained by nonprofits with this degree of availability, although they do exist. ProPublica, for example, maintains a number of different databases, such as the Nonprofit Explorer, that are designed to make some of that publicly available data more easily usable in a research context and in a structured way. In other cases, though, that the data may only be available as part of a PDF of a longer report published by that organization. So there can sometimes be issues with just on a technical level accessing that data if it's not necessarily made available in the form that works for you. But you can always contact the organization in order to see if it's possible for them to share that data in another form. And those reports often give very critical context as well on how that data gets collected. So some examples of what gray data from NGOs and nonprofits might look like would include real-time monitoring and reporting data around topics such as public health, emergence of new diseases or the spread of illnesses, for example, where NGOs may play a role in some of that reporting in addition to governments. There may also be program evaluation data that gets shared as well. So, for example, considering the effectiveness of vaccination campaigns that non-governmental institutions may play a role in as well. And then, as I mentioned, a lot of that data may be found in annual reports put out by organizations as well, which may just be a series of tables or an appendix as part of that report, or may be supplemented with additional detail with data in the form of a database or a tabular data set as well. One thing that's particularly important to keep in mind when it comes to data sets that you're accessing via a nonprofit or non-governmental organization is bear in mind that the organization that is making that data available to you is not always the organization that produced it. A lot of times organizations will sort of play a role as an aggregator of publicly available information, which can be very helpful in sort of having a lot of relevant material all in one place. But that means that not all of that is collected by a single organization, which in turn means that there may have been a variety of different data collection methodologies that were used for all of those different pieces of data there. So it's always important to make sure that you can say with confidence who was it that was doing this original data collection, what were the methods that they were using, and are the different data sets that have been aggregated here directly comparable to one another, or are there some caveats or limitations on how it can be reused in that way? And then lastly, perhaps kind of the grayest or fuzziest corner of gray data would be institutional records. So this is thinking along the lines of the massive amounts of data that organizations, including UK healthcare, for example, generate that is not created for the purpose of research, but more has to do with kind of daily operations or other infrastructure with the management or running of that organization. But it can still often be very useful in a research context as well. So thinking in a healthcare context, we could think about data sources like scheduling and appointment data for patients, billings and claims data, information related to supply chain, inventory, or purchases by an organization, incident report logs, or environmental data such as foot traffic through a hospital or through a clinic, or other data points that might be collected around sort of the physical circumstances or operations of that organization. So while we will go through and show some examples of government data and nonprofit or NGO data, we won't be showing institutional data sets in the same way, in part because these will often not be available for you as a researcher through a publicly available data portal in the same way that some of those other sources of data would be kind of readily available to you. But I like to talk about it and point it out because these institutional records often can be shared and made available in a research context under the right circumstances, particularly when you're working with any data derived from human subjects here. The organizations will have different policies around sort of under what circumstances they would release that de-identified information to researchers. And so this will very often be kind of a longer process of getting access to that data, and one that's going to involve a lot more contact points with other people in that organization. But it is still another way that we can kind of think about data that's produced not for the purpose of research, but can, with the right steps and in the right circumstances, be transformed into something with that research purpose. And so I'm going to note a few useful data sources here in addition to data.gov and healthcare.gov. And then we'll conclude with a tour going through some of these as well so that you can get a sense for them. But one of those is Global Health Data Exchange, GHDX, which is made available by the University of Washington College of Public Health, I believe. And they have an Institute of Health Metrics research, so they make a lot of their own data available through this platform. But they also aim to aggregate and catalog public health data that gets produced internationally by within a research context, but then also by demographers and by government institutions as well. So they can be a good source for if you're looking for population level data on an entire country or kind of just want to see what sources might be available. They can be a good place to direct you there. One data source that we subscribe to at University of Kentucky and make available through the library is Roper iPoll, which makes available a large variety of polling data on a number of different topics. Many of those polls have to do with politics. There's a lot of kind of candidate horse race polling in there, but there is issue polling, opinion polling as well. They have a really large trove of survey information from the COVID-19 pandemic and questions around sort of vaccinations, trust in public health, et cetera. And then they also make available data sets that are produced by businesses, by nonprofits, and by advocacy organizations as well, such as the AARP. So that can be another useful source for kind of tracking changes in topics like trust in institutions or public health institutions over time, since a lot of those polling firms ask the same questions longitudinally and give you an opportunity to kind of look at change over time there with the same methods and methodology. And then finally, another source that Kayla spoke about a couple of weeks ago is Policy Commons, which is a compendium of resources and reports by think tanks and other policy organizations on an international level. One thing I hope I will be able to show today is that on the data side, particularly, they use OCR, optical character recognition, to automatically identify some different tables in those reports. So whenever there's a table of data presented, it will be easy to identify there, and then even download as a CSV so that you don't need to worry about the process of kind of copying that over by hand. So there were some issues with Policy Commons, just given the Cloudflare issues that were happening earlier today. So I'll see if I'll be able to access that one. Before we take a tour of some of those sources, though, I wanted to wrap with just some of those important questions that you need to ask yourself when you're evaluating gray data and whether or not it will fit whatever research task you have put before yourself or the research question that you have. The first of those, as I mentioned previously, is to make sure you understand the context of how that data was collected and to what extent, and more importantly, why you can trust that the data there is accurate. To help you answer that question, ask who produced the data, so what organization, and what was the primary purpose for them to collect that. The questions of authority and evaluation here are often more complicated than, is an organization lying about its numbers, and more to do with kind of what data are they putting out and under what circumstances. So, for example, issue advocacy organizations put out a lot of survey data or data evaluating the effectiveness of their programs, but they won't, because their primary purpose is issue advocacy, they may not necessarily put out data or surveys that would kind of portray that organization in an unfavorable light or suggest that their programs are not effective. So that's not to say that those organizations are lying with the data or evaluations that they do put out, but it is kind of important to make sure that you, if you are looking at kind of, effectiveness of a particular public health program, that you would be doing a more robust gathering of data than just data put out by organizations that have a vested interest in the success of that program. Um, a lot of these organizations will include information around their data collection methods. And that is kind of the primary way that you are going to be able to evaluate whether or not this data is trustworthy and whether or not it is of sufficient quality for the or for the type of research that you want to conduct. And if it maybe doesn't rise to that standard, that doesn't mean that you can't use it, but it does mean that you should be looking at other potential sources to supplement that as well, or consider what limitations you would need to discuss in any publication around how that around the evidence that you're presenting in your article. Another important question to ask is, can the data source be integrated with others? This can come up particularly if you're trying to aggregate data sources that may all be of the same type, but may have been collected under very different circumstances. So the clearest example of this to consider is when you're trying to aggregate different survey data, or perhaps you're trying to look at kind of change around respondents' answer to a question over time. If the methods that polling organizations have used to contact participants have changed over time, then that is presumably going to have an impact on the sample of the population that they're looking at. It will have an impact on the sample that is responding to that survey. And as a result, that means that those results from an earlier period may not be directly comparable to ones from a later period. The same questions would apply to multiple different surveys on the same question that are collected by different polling firms using different methods. Sometimes that heterogeneity is good because it can sort of make findings more robust, but it is important to understand to what extent those data sources will sort of play nicely with one another and can be compared to one another. And this is a topic where it can be good to consult disciplinary experts as well around some of that methodology if you are looking to perform any kind of meta-analysis or combine results from multiple different findings here into your own research. So consider those factors as well. And then finally, consider, particularly whenever you're kind of constructing your own data sources, consider if the data that the use of your data is ethical. So this can come up particularly whenever you're aggregating or working with data from, for example, on social media or other sources of data that we might see considered to be publicly available. Anyone with internet connection would be able to go and access that post by that individual. It's important to consider that when people put things up online, they are not always considering that this is going to be archived or collected by a researcher and then made available as part of a research article or in kind of a permanent form. There's been interesting studies on internet users and particularly around sort of different internet subcommunities that might exist on sort of what the expectations are of people who are posting or putting information up online. And their expectation is often much more that that information will be used within by other members of their given community. They aren't often thinking in terms of researchers going and accessing that information in a research context or kind of making it more permanent than what an ephemeral post might be. So obviously that can be a very tricky and thorny issue, and the standards for it will really be different, not only within academic research, but even from one discipline to another. So my overall recommendation is that whenever you are working with data that is derived from human subjects, even if you are not directly making contact with them, do consult with the IRB at UK or whatever institution you're conducting research at just to be able to have a conversation, make sure your bases are covered, and potentially hear some of those countervailing opinions on maybe the human subjects that this data was derived from didn't have this expectation that it would be used in this way, and therefore maybe that means that you shouldn't use it in the research context that you're planning. So always do kind of have that thought in the back of your mind of, am I acting with beneficence here? If there are humans behind this data, am I using it in a way that is ethical? And am I engaging with the right institutional bodies to make sure that there are some checks on that usage as well? So now, before we go to questions, I wanted to go and just through a brief tour of some of those data sources that I mentioned to just kind of show how they work and talk about some of the things that they're good and less good for when it comes to finding some of these great data sources. So the first of these is data.gov, which is kind of the simple home and catalog for a lot of different data sets that get produced by the federal government. You can see they have more than 360,000 data sets that get made available. So this can kind of be a good starting point if you're just kind of trying to conduct a simple search on a topic, see what might be available out there. But I'll note that even though this is very wide ranging, this is not necessarily going to be a one-stop shop for all of the different data that you might need to be able to access. For example, different departments of the U.S. government update their offerings here at different speeds. So there's not necessarily a guarantee that it will always have sort of the most up-to-date data that you need available. But they make this available through a simple, or data searching available through a simple keyword search. So if we just tried public health, for example, we would see a very wide array of data sets that are made available there. There are several different tags here that make this useful to work with and easier to filter. One of those is this banner on the side that shows, is this data produced by a federal agency, a city one, and I believe there's a flag for state agencies as well. They also very usefully show the different file formats that the data is made available in. So CSV is usually one of the easiest to use file types. It stands for comma separated variable, and that's kind of traditional tabular data that you can load in Excel or another spreadsheet software. JSON and XML are other common open file formats for working with data that may have a nested structure to it. And if those are new file formats to you and you want to try working with one of these, then feel free to meet with me and we can have a conversation about how about some common tools for being able to work with those. There are some topics that are assigned as well in terms of different tags for the topics covered by these data sets, as well as the different types for those data sets as well. Again, these are designed as topics that will and keywords that will work for the entirety of the federal government. And so as a result, they wouldn't have the specificity of, for example, mesh subject headings or other subjects that might work well or work better within the confines of a particular discipline like public health. But as you can see from the results that come up here, this can be good for kind of getting a wide variety of data sets that might be relevant to public health. So chronic disease indicators, walkability data from the Environmental Protection Agency, drug overdose death information, air quality, mental health care that people have received in the past 4 weeks, which I assume would be survey data. So this can be a good way if you aren't necessarily quite sure which agency might be producing the kind of data you're interested in finding. This can be a good place to start and locate some of that. But do keep in mind that it is not necessarily comprehensive. And so even if you can't find a particular data set, this doesn't necessarily need to be the last place that you look for it. Another helpful source can be healthdata.gov from the Department of Health and Human Services. So this includes a lot of data produced by HHS itself, but also does aggregate some open data sources from other sources as well. Um, Again, the same caveats apply for data.gov, where this can be helpful in terms of being able to find, kind of get an initial pass at what data might be available. But it will not necessarily be the last place that you search or the only source that's available for you. So here, by default, they have data sets organized by the order in which they were uploaded. Like one resource here, respiratory virus hospital admissions over time, is that kind of institutional data that I was talking about previously, but that in this case is reported to the federal government. And so as a result, can provide some of that aggregated information. Off to the left here, you have many of the same types of search features that might be available. Unfortunately, this catalog doesn't allow you to search by the file type. So as a result, sometimes you may find a data source that topic-wise is perfect for what you need, but may not be applicable if it's not in a format that you need it to be in. So keep that in mind when you search this one too. Now, I mentioned as well Global Health Data Exchange from the University of Washington. And this can be a great place for finding a lot of different public health information from a variety of different sources, not just from within academia or research, but produced by some of those other great data sources, nonprofits, governments at different levels, that type of thing. So since this is designed primarily for working with international data, they do give you this handy ability to search by country. So if we search for India, for example, then we would be able to see the country profile that GHDX offers on India, and then see the most recently added data sets for them as well. In many cases, these data sets are tagged by any country that is kind of implicated in that data. So this pandemic resource survey indicators data, for example, we would see that this actually covered a wide variety of different countries, but included India. So that can be really useful because sometimes the general description of a data set won't necessarily include all of the countries where that research took place. But so this can be helpful for being able to identify some specific countries within that larger data set. And then they also identify, helpfully, the type of data as well. So survey data, scientific literature, I believe they have vital records as well. Yeah. So if you, for example, needed to find records of births and deaths from either a country or from a state, um, this can be a good place to check because these catalog entries will link out to the provider of that data set. So again, this can kind of serve well as a source for data discovery because it means that you don't need to know, that the Department of Economics and Statistics of this government is the one that records this vital information and these vital records information and makes it available. But by going to a place like GHDX, you would be able to kind of do a search, identify it, and then know more about or dig more into specifics on that website or from that original source. One weakness I found in GHDX is that sometimes these links are not always kept updated. So particularly if you are looking for data sets from that are less recent for whatever reason, you may have more trouble being able to locate some of that information at those URLs if those URLs have changed. But through some additional searching, you may be able to find where it moved to. So the other fourth source that I wanted to discuss is one that we make available through UK libraries, Roper iPol. One thing that I really recommend for searching here, is if you're interested in health data in particular, is their health polling collection. And in particular, they provide this useful concept map of different related topics in public health. And so what's useful about this is you can kind of see some of these broad topics. I believe they have like social determinants of health, mental health, nutrition, policy and politics. If we just go to social determinants of health, for example, what's useful about this map is that it shows you all of the subtopics that we could find related to one of these questions as well. And so once we've identified sort of an area that we're interested in looking at for survey research, we could then click this Go to Questions button, and it will take us to a search for, in this case, social determinants of health, broadly speaking. Roper iPol classifies all of its questions or all of its data both on an individual question level, but as part of a larger study as well. So looking at these individual questions, this survey conducted by Ipsos on behalf of ABC News looks like it had to do with candidate or election, so having to do with politics, in this case, voting for president. But it was asking a question about crime and safety and how important people find that topic to be. So these questions can be useful to look at and look through. But again, keep in mind that they will often kind of be aggregated as part of a larger source of questions. And so there may just be sort of one question that you're interested in. Do also make sure you do some research on the different organizations that are conducting these surveys as well. Because they specialize so heavily in politics and policy data, Roper iPol has a lot of different data sets that are put out by issue advocacy organizations or by political parties. Again, that doesn't mean that that data is false or has no value, but it is important context that you need to keep in mind and hopefully be able to sort of cross-reference against some other data sources as well if you plan on working with it in any research context. I'll also note there are a lot of useful filters over here to be able to filter by things like the different health categories, the organization that is producing that data. So if you are looking for data produced by a particular organization, then you can search for it there. And then most helpfully, the way in which the data is able to be accessed. I often suggest that researchers, when they're first starting out, search for data sets that are available as a CSV. That way you can download that data, get it as an Excel file, and then or as a CSV, and then be able to work with it in some of the software formats that you're already familiar with. And then finally, I was having some issues with this previously, accessing Policy Commons, so we will see if this works for us now. Now it's forgotten me. But hopefully it will actually let us get there. And I'll mention too, while this is loading, that I'm only going to be talking about this kind of briefly, but Cato Robinson in her presentation on gray literature more broadly talked about this in a broader context and showed off some of the more of the capacity of policy commons as well. But as I mentioned, this is a source that aggregates reports and publications put out by a variety of think tanks and nonprofits. And one of the useful features of it is this tables tab here. And if you click on that, what this will give is a search specifically looking for any search terms that you put in, and then publications that include tables somewhere in them. Again, this process is designed to sort of be able to automatically go through and recognize some of these tables and pull them out. So sometimes there will be issues there. But if we looked at, this OECD Digital Economy Outlook report and clicked on one of those tables, then we would be able to see the table that got pulled out here on, which in this case is of adult internet users engaging in various online activities. And then with this button here, we would be able to download just this table as a CSV. And then that would make it easier for us to work with more quickly. There are sometimes errors there just in how this automatically gets rendered as a table. So do make sure you check that there. And of course, make sure that you go and read through the entire report as well in order to make sure that you understand the context behind that data set, understand how it was collected and whether or not it's something that you can use. But this then is also an option for being able to go and view this report, typically in the context of the publication as well. They will sometimes include a page number. So this table is found on page 108 of this report. So that can sometimes simplify the process of knowing, rather than having to trawl through a lot of different reports that may or may not include relevant tables. This can kind of simplify the process of identifying reports that might include one of these tables, and then go and look at those ones in more detail. So that's a useful feature of Policy Commons here. So thank you all very much for your time today. I hope that this was useful in understanding not only why it can be useful to look at some of these sources of gray data, but also think through some of the questions of how you can evaluate those and determine if they're fit for the research that you're looking to conduct. So Laura just put an evaluation survey in the chat. Please do fill that out so that we can improve the offerings that we have for researchers like you out of UK libraries. And thank you all very much for your time. I'm now open to questions either in the chat or feel free to come on mic if you prefer. Thank you.